If your trail knee hurts after golf, don't click away just yet. Let's walk through this one together. I know how frustrating that can be because one small pain or annoyance can make you wonder if the game that you love is starting to slip away. I'm Dr. Gayan Poovendran. I am an orthopedic doctor who loves golf, and for the last 15 years, I have helped thousands of golfers reclaim the game they love without having to resort to invasive surgery. And if your right knee has been bothering you on the golf course, you're in the right place. See what I did there? Okay, quick question. Before we go any further, where exactly does your knee hurt? Is it on the inside? Is it on the outside? Is it in the front of your knee? Is it deep inside like you can't get to it? Keep that in mind because we're gonna come back to it later. Now let's address the elephant in the room. Everybody talks about the lead knee. That's the one that's in slow motion. That's the one that it's in the finish. That's the one that gets all of the attention. But the trail knee, that's the one doing at least half the work. It bends, it loads, it stabilizes, and then it has to deal with the rotation. And here's the problem. Your knee is designed to be great at bending and straightening. It is absolutely terrible at twisting. So when your trail knee hurts, that tells me that something is being overloaded. And in this video, I'm going to break down the most common causes of right knee pain in golfers. I'm going to explain what's happening inside the knee in plain English for you. I will also show you where that pain may be coming from. And then finally, I'll give you some simple things that you can try at home or right before your round to help try to nip that knee pain in the bud. Are you ready? Does it sound good? Okay, let's get into it. Why does the trail knee matter? In right-handed golfers, your right knee is the trail knee. It bends in the backswing, it holds you up, it loads your weight, and then it deals with the twisting when you rotate. And I said before, the knee loves bending and straightening, but it hates to be a twisting machine. It is not chubby checker. So when it hurts, something inside is getting overloaded, and golf exposes that super fast. And the knee, being the drama queen that it is, tends to let you know about it. So let's talk about what's inside your knee. There are three key players that drive knee pain. The first one we'll like to talk about is the meniscus. Right in here, in between these two bones, the meniscus is a shock absorber between these two bones. When you twist on a bent knee, that meniscus can get pinched and start to hurt. Number two culprit is the ligaments. These are the ropes that keep things stable. So you have one here and you have one here. These stop wobbling and side-to-side stress. These keep your knees from popping out of place. Number three culprit is cartilage. This is the smooth lining for gliding of bones. This is that white shiny end of the chicken bone that you all know about. If it wears down over time, which it's going to do, it's going to lead to stiffness. Now, don't forget this because this also comes in for later. Weak hips and thighs, the knees will pay the price. So when we talk about trail knee pain, what we're really asking is this question: what part of your whole system is getting overloaded? So let me make this immediately useful to you. Where your knee hurts actually tells us a lot. If you have pain on the inner part of your knee, this is the part that's on the inner side of your body, that tells me that your medial meniscus or your medial collateral ligaments could be at risk, and that comes from a twisting stress or a twisting injury. If it's the outside of your knee, the outer portion of your leg, that could be your lateral meniscus, or it could be your IT band, or even your lateral collateral ligament. Now, sometimes these come from just the compressive force. If the pain is in the front of your knee, we have to worry about your kneecap and the kneecap tracking. Bending and straightening overload can cause difficulty with alignment of your knee and can cause knee pain. If the pain is deep inside, like you can't quite find it, but you know it's there, then you have to think about cartilage or meniscus wear. So instead of just saying, my knee hurts after golf, what should I do? Try asking yourself, where exactly does it hurt? That one shift alone puts you ahead of most golfers in my office. So let's talk about the swing and what golf is doing. Golf is not a nice, smooth turn. It's actually pretty violent. It's a mix of bending and loading, rotating, and shifting weight. And the trail knee gets caught up in all of that. These are the biggest injuries and the biggest things that I see. If you're twisting on a planted foot, which means that if your foot stays stuck firmly in the ground while your body rotates around, your knee becomes a corkscrew and your meniscus hates that. Number two swing fault is the knee caves inward. If the knee collapses inwards during your downswing, that can stress the inside portion of your knee and it can lead to damage of your medial collateral ligament. It can also strain the medial meniscus and the other supporting structures. Error number three that we see is you swing harder than your body is ready for. A lot of golfers out there think that more speed equals better golf and more power, but sometimes it just means more knee pain and more inflammation. Number 4 problem I see is weak hips. You know, Shakira said your hips don't lie, right? So if your hips aren't controlling the movement, your knee has to. And once the knee becomes a backup employee for your whole lower body, it's usually going to start complaining about all the overtime. And this is where most golfers miss it. The most common causes of trail knee pain. So let's go through the main ones at least. Number 1, meniscus irritation. This is the big one. Remember the meniscus right in here? The meniscus gets unhappy when the knee is bent and it's twisted at the same time. And guess what golf loves to do? Yeah, it's exactly that. What does meniscus pain feel like? It feels like a sharp pain on the inside or the outside of the knee. Remember medial meniscus, lateral meniscus? You'll have pain when you're turning. You may feel pain when you're squatting. Sometimes patients will complain to me that they have a clicking or catching sometimes. A lot of golfers will sometimes also describe it as a grab deep inside the joint. So if your knee feels like it's catching or pinching or it's getting stuck for just a second, your meniscus may be involved. Injury number 2 is the inner knee strain or the MCL. If your trail knee keeps collapsing inwards, the inner structures of the knee can get irritated. Now that may feel like aching on the inside of the knee or soreness after a round. Sometimes you may have some pain with twisting. This is common in golfers who feel like their trail knee dives in towards the middle of their body or caves in during their swing. Number 3 is if you have pain on the front of the kneecap cartilage may be the issue. Now this can happen when the knee is bending and straightening a lot, or if the muscles that guide the kneecap are not helping enough. Think about this as like your alignment on your car is off, where it's pulling to one side. What does that feel like though? That feels like pain specifically on the front of the knee. You may complain of pain going up and down stairs. You may have pain when you try to stand up from a chair. Sometimes you may also notice that you have a grinding or a rough feeling behind the kneecap, like there's sand back there. That kind of pain can make really simple things feel really annoying. Kind of like, stop me if this doesn't sound familiar, why does getting off the toilet now suddenly feel like it's a workout? The 4th common cause of injury is arthritis or cartilage wear. If the knee has been under stress for a long amount of time, the joint surfaces start to wear down, and that can cause a deep ache and stiffness. That can cause swelling after golf. That also causes pain that sticks around longer than you want it to. Now, if this sounds familiar, your knee may not be angry about one particular swing, but it could be angry at you about the last several years of golf. So this is really important. Why are golfers ignoring the trail knee? Well, because it's sneaky, because the trail knee is not the flashy one, it's not the star of the swing. It doesn't get all the glamour shots, but it does get a lot of the work. And because the pain often starts off something small, golfers tend to kind of brush it off. They will tell me things like, yeah, I didn't think about it, it's just a little sore, or they'll say, I probably just slept on it wrong, no big deal. Oh, you know what, I just need to stretch, no issue. My favorite one is, it'll be fine after I warm up. Then the next round comes along, and guess what? The knee is still unhappy. The thing about knees is this: they aren't your ex from college. They rarely wake up one day and decide to be dramatic for no reason. They are your spouse. They have probably been sending you a warning sign for years that you've been missing or ignoring. Okay, so let's test your knees right now. First one we're gonna do is called the trail knee twist test. And you say that 3 times fast. Stand next to a chair or countertop for balance. What you're going to do is you're going to put your weight on your right leg, and you're going to have a nice soft bend in your knee. Now from there, you're going to gently rotate your body left and right just a little bit. Don't force it. Now ask yourself, did that bring on pain? Now, if it did, is the pain on the inside? Is it on the outside? Is it on the front? Is it in the back? Is it deep inside? Does it feel sharp? Does it feel pinchy? Does it feel like it's going to catch? If a small twist on a bent knee bothers your trail knee, that may point to meniscus irritation or stress on the side structures of your knee. Now, here's another quick test. This is a mini squat. Try this one in front of a mirror so you can see yourself. Stand with your knees with your feet about hip width apart. What you're gonna do is you're gonna do a mini squat, like you're trying to sit into a chair. Watch what your right knee does. Does it stay lined up, or does it start to cave inwards? If the right knee collapses inwards, that tells us that the hip and thigh muscles may not be controlling the leg well. And if the knee is not controlled well, the golf game will find that weakness faster than you would like. So let's talk about some simple exercises for the trail knee. These are things that you can do at home or on the course right before your round ground, they give the trail knee better support, or they train the knee to have better support so that it's not doing all the work itself. The first exercise is that test that we just did. It's the mini squat. You're gonna do 2 sets of 10 repetitions each. Stand with your feet shoulder width apart, keep your chest up, keep your knees nice and soft, and now just do a little bend like you're trying to sit back into a chair. Now come back up. You don't need to go really deep. This is not a deepest squat contest. What we're doing here is we're just teaching the knee to load and unload in a controlled way. What this helps is build basic leg strength and help the knee track better. Think small, smooth, and controlled. We are training the knee. We are not trying to impress anybody at the gym, and you're probably doing this at home, so maybe you're just trying to impress your wife. I don't know. Number 2, standing hip abduction with a resistance band. Same thing here, 2 sets of 10 repetitions each side. What you're gonna do is you're gonna put a resistance band around your knees, just above your knees. Stand tall and hold on to a chair or a golf cart for balance, and slowly lift one leg out to the side. Keep your body upright. Don't start leaning or swinging your leg like you're trying to kick open the saloon door. What this helps is this helps strengthen your hip muscles that help stop the knee from collapsing inwards during your swing. Remember, strong hips are like good bodyguards for your knee. They help keep you out of trouble. Exercise number 3 is a single leg balance. So you're gonna stand on your trail leg for 20 to 30 seconds, and you're gonna keep your knee slightly bent and your body tall. Do this twice. If that feels really easy, try it with a gentle arm motion or while holding your club across your shoulders. This helps improve your balance and control, which matter a lot when you're rotating through your golf swing. Now, if you can stand on one leg for 30 seconds without looking like a newborn giraffe, you're doing pretty well. Exercise number 4 is band side steps. This is, again, 2 sets of 10 repetitions on each side. Place a resistance band around your ankles or your knees. Get into a small athletic stance and then side step for 10 steps one way and then do 10 steps back to the middle. Also, make sure that you're keeping tension on the band the entire time. Do not let your knees cave inwards. What this does is this helps strengthen, again, the hips and your outer thigh, which help protect the trail knee from caving inwards. Now, this one looks really easy until you start doing it for about 30 seconds, and then suddenly your legs will remember that they also have an opinion. The last exercise I want to talk about is calf raises. Once again, 2 sets of 10 repetitions. Stand behind a chair or near a wall for support. Now, slowly rise up to your toes and then slowly lower yourself back down. You can do both feet at the beginning, but I want you to be able to progress doing this 1 foot at a time. What this is going to help is this helps build your lower leg support and improves control throughout the whole kinetic chain. This is a tiny movement, but it does have a big payoff. The calves are a small muscle, but they still like to pretend like they're really important. So let's make this even more golf specific. The trail knee gets loaded during your backswing, right? It helps hold your body in position, it helps you absorb force, and then it also, if your swing starts to get too aggressive, it can be asked to do too much. Now, these things get worse when the stance is too narrow, or you try to stay too still in your lower body, or if your backswing is forced. If you're chasing power, this can also be a problem. And finally, if you practice a lot on hard ground or uneven lies, you can be overstressing this leg. So if your right knee hurts, it's not always because golf is the problem. Sometimes the problem is just the way that your knee is being asked to work inside the golf swing. So let's talk about some quick fixes for that and what you can do. Number 1, stop forcing the knee to twist. The knee should not be the main source of rotation. It is not chubby checker. Try to let your hips and trunk rotate together instead of cranking the knee like it owes you money. Number 2, work on your hip strength. Strong hips help keep the knee from collapsing inwards. Number 3 is a very simple one, but it gets missed a lot. Warm up before you play. Just a few minutes of movement can help a lot. Your knee does a lot better when it's warmed up and you don't ask it to go from sitting in a parked car to full golf swing in the amount of time that it takes you to walk from the car to the tee. Number 4 is back off the power swing for now. If you are trying to hit bombs and your knee is angry, just ease up a little bit. You don't need to win the long drive contest at your local muni with every swing. Number 5 is really important. Don't ignore locking or swelling or buckling or giving way. If the knee locks or swells a lot or feels unstable like it's not underneath you, that deserves a real evaluation. That is not normal golf soreness. That is your body waving a little red flag and saying it's time to go see the doctor. So here's the bottom line. The trail knee doesn't get a lot of attention, but it takes a lot of load from the golf swing. The pain usually comes down to a few things. It comes down to too much twist, too much collapse, too much load, or not enough support. If you fix those things, you will start to notice a change. And now it's time for my standard disclaimer. Yes, I am a medical doctor, but I am not your medical doctor. Not yet anyway. This video is meant to be educational. It is not specific advice for your situation. Now, if this video helped you, hit like so that it can help other golfers find this. Your lead knee gets the spotlight, but the trail knee does a lot of the work. And when it starts talking, it's something worth listening to. I'm Dr. Gayan Poovendran. I'll see you pain-free on the fairway.